Right now, as you listen to this, your upper body is actively trying to crush your legs. I mean, gravity is constantly trying to fold your torso backward, and the sheer weight of your internal organs, your ribs and your head is just pushing straight down.
Oh, yeah.
Constantly.
Yeah, but you don't collapse. And why is that? It's because of a single hidden architectural masterpiece.
It really is. It's the ultimate biological shock absorber. I mean, it's the foundational structure that allows humans to stand upright, absorb massive impact, and walk around without crumpling into a heap.
Welcome to this deep dive. Today, our mission is to explore that exact foundation, the hip bone and the hip joint. We're going to look at how human anatomy perfectly balances the immense crushing weight of the upper body with the dynamic explosive movement of the lower limbs. And to do that, we're drawing our insights today from expert anatomical breakdowns by Ken Hub. What's great about this material is that it maps out both the skeletal architecture, the os coxae, and the incredible mechanics of the joint itself. It moves way beyond just Latin terminology to show us the physical reality of how we move.
Exactly. So whether you are sitting in a chair right now, or maybe standing at a desk, or out for a walk, this deep dive is going to fundamentally change how you understand the mechanics of your own body. So, okay, let's unpack this.
Let's do it.
We have to start with the foundational structure. You really can't understand the joint without understanding the bizarre, unique bone that actually houses it.
Right, because the hip bone is technically a bilateral bone of the pelvis. You have a right one and a left one, and together they form this bony girdle that connects your axial skeleton, so your spine and ribs down to your legs. But the most surprising thing about it is its origin story.
Yes, this completely shifted how I view the human skeleton. I mean, we grow up thinking of the hip bone as one solid, monolithic piece of calcium.
Oh, for sure.
But it's actually a compound structure made of three completely distinct bones. You've got the ilium at the top, the ischium at the bottom back, and the pubis in the front.
What's fascinating here is that these three bones develop completely independently. Like, if you look at an x-ray of a young child's pelvis, you don't see one solid hip bone.
Really?
No, you see three separate bony islands just sort of floating in a sea of cartilage. They don't actually fuse together into a single complex bone until we hit puberty.
Wow. It's wild to think you spend your entire childhood walking around on a cartilage puzzle that is just, slowly ossifying. Let's look at how those three pieces function, starting with the ilium.
The big one.
Right, that's the largest part, the massive blade-shaped bone at the top. Actually, if you're listening right now, put your hands on your hips. That hard ridge you feel right on your hands, that's your iliac crest, which is the superior border of the ilium.
And that crest isn't just a convenient hand rest. Biomechanically, it is doing an immense amount of work. It serves as a major anchoring ridge for a massive network of abdominal muscles, back fascia, and lower limb attachments.
This is basically a central hub.
Exactly. It acts as a tension hub for your entire core.
Now, in the medical field, the iliac crest is famous for something completely different, which is bone marrow biopsies.
Oh, right.
Yeah, when doctors need to diagnose a hematologic disease, they numb the skin, take a cutting needle, and drive it directly through the cortical bone of the crest to extract the marrow inside. But thinking about the engineering of that, if you need bone marrow, why bypass the massive femur bone in the leg or the ribs and go straight for the hip?
Well, it's a perfect convergence of accessibility and safety. As you just felt, the iliac crest lies practically flush against the skin.
Right, you can feel it right there.
Exactly. So a doctor can easily palpate it, meaning they know exactly where they are placing the needle without relying heavily on imaging. And more importantly, it's a thick, stable vault of cortical bone with a highly active supply of cancellous marrow inside.
Which is exactly what they're looking for.
Yeah. And if you try to extract marrow from the ribs, one slip of the needle and you risk puncturing a lung, entering the back of the pelvis keeps the instrument safely away from your vital internal organs. It is simply the safest, most reliable window into the body's blood factory.
That makes total sense. So the top piece, the ilium, is our muscle anchor and our marrow vault. But the pelvis also has to support us when we aren't standing, which brings in the second piece on the bottom back, the ischium.
Specifically, a very dense, rough protrusion on the ischium called the ischial tuberosity.
I like to think of these as our sit bones. If you were listening to this while sitting in a chair, you are physically resting your entire upper body weight on those two bony knobs right now.
And they're structurally designed to take that compressive punishment all day long. But they also serve a highly dynamic function.
How so?
Well, that rough surface is a massive anchor point for your posterior thigh muscles, your hamstrings. When you sprint, the sheer pulling force your hamstrings exert on the ischium is enormous. The bone has to be thick and dense to keep the muscle from ripping right off the skeleton.
Oh, wow. Okay, so the top and back handle the core anchors and sitting.
Yeah.
But the pelvis still has to close the loop in the front to stabilize the whole structure. That is the third piece, the pubis.
Right, the smallest of the three components. It sweeps forward to form the anterior part of the hip bone. The two halves of your pelvis meet right in the front at the midline at a cartilaginous joint called the pubic symphysis.
And that completes the circle.
Yeah, this creates a closed structural ring, which is crucial for protecting the delicate organs in the pelvic cavity.
So we have these three highly specialized bones coming from three different directions. But the true genius of the pelvis is exactly where they intersect.
They all crash together in one central location on the outside surface of the bone to form the acetabulum, or, the socket.
And it's a remarkably deep, cup-shaped socket. The ilium forms the roof, the ischium forms the back and bottom walls, and the pubis forms the lower front. It's the exact spot where the spherical head of the femur, the thigh bone, locks into the pelvis.
And inside that cup, there's a specific weight-bearing area called the lunate surface. It's covered in thick hyaline cartilage and shaped exactly like a crescent moon.
So it's like a lunar crater on the side of the pelvis. What struck me about the biomechanics here is that this cartilage-covered track isn't a uniform thickness. It is broadest and thickest at the upper front section of the cup.
Which aligns perfectly with the physics of human locomotion. When you walk or run, the vector force of the femur doesn't just push straight up into the socket. The mechanics of your stride drive the bone up and slightly forward.
I see.
So the lunate surface has evolved to be thickest right where that physical pounding demand is at its absolute highest.
But I'm trying to visualize the physics of this closed joint. If I'm looking at this cup, there's a literal hole at the bottom. It's called the acetabular notch.
Right.
So the socket doesn't form a complete circle. Now, at first glance, a heavy-duty weight-bearing cup with a gap in the bottom seems like a design flaw. But I'm guessing a solid bone ring grinding against the femur during a heavy squat would just crush anything caught inside it.
You hit the nail on the head. Nerves and blood vessels need a way to get deep inside the joint capsule to nourish the tissues and relay sensory information to the brain. If the bone formed a complete uninterrupted rim, the incredible compressive pressure of the femur would obliterate those delicate structures.
So the notch acts as a safe harbor.
Precisely. And it doesn't stay an open notch. A band called the transverse acetabular ligament bridges that gap. By bridging it, it turns the notch into a protected tunnel, a foramen.
Right.
The neurovascular bundle can safely slip under that ligament bridge, completely shielded from the grinding mechanics of the joint above.
That is an incredibly elegant solution. You get the structural integrity of a cup without severing your own biological wiring. And to deepen that cup even further, you have the acetabular labrum.
Think of the labrum as a dense, fibrocartilaginous rubber gasket lining the rim of the socket. It physically raises the lip of the cup, increasing the total articular surface area by about 10%.
Wow, 10% is a lot.
It is. It grips the head of the femur, creating a suction effect that adds immense negative pressure stability to the joint.
Now, speaking of holes in the bone, we can't ignore the massive gaping window right below the socket, the obturator foramen. Framed by the pubis and ischium, it looks like you could throw a baseball through it.
It is huge, but nature abhors a vacuum. In a living body, that space isn't just an empty void.
Right. It is sealed off by a flat sheet of connective tissue called the obturator membrane, leaving just a tiny canal at the very top, which, again, acts as another dedicated tunnel for the obturator nerve and vessels to safely travel from the pelvis down into the inner thigh. It's a brilliant example of weight reduction. The body carves out the heavy, dense bone it doesn't need and replaces it with a lightweight membrane that still provides a surface for muscles to attach to.
It maximizes efficiency. You get the broad surface area from muscle attachments without having to carry around the metabolic cost of solid bone.
Okay, so we built the bony architecture and we have our deep, gasket-sealed socket. Now we introduce the femur and the massive strapping system that keeps our legs attached to our body.
If we connect this to the bigger picture, we have to look at how the body negotiates the ultimate physical trade-off, which is stability versus mobility. The shoulder and the hip are both multiaxial ball and socket joints. They are anatomically very similar.
But mechanically, they have entirely different missions. The shoulder is all about extreme mobility. We need to reach overhead, behind us, across our bodies.
Which is exactly why shoulder dislocations are so incredibly common. The joint capsule is shallow and loose to allow for all that freedom. The hip, however, sacrifices that extreme mobility in favor of absolute unbreakable stability.
It has to.
Yeah, it is the most stable joint in the human body, simply because it has to transmit the entire weight of your upper body down into your legs every single time your foot strikes the ground.
And the first layer of that defense is the fibrous joint capsule. Just like the socket's cartilage, the capsule is thickest in the front and top where the tension is highest. But it also features these circular fibers called the orbicular zone, or the zona orbicularis.
These are fascinating because they don't actually attach to any bone. There are deep fibers within the capsule itself that form a tight, continuous ring completely around the neck of the femur.
It's essentially a biological turtleneck. It physically cinches down around the bone to keep it from slipping out of the socket.
Okay.
But here's where it gets really interesting.
Oh, yeah.
The capsule is heavily reinforced by ligaments that are absolute units. Specifically, the iliofemoral ligament, which is a thick, inverted Y-shaped band sitting across the front of the joint.
Also known as the Y ligament of Bigelow. It is officially the strongest ligament in the human body.
The absolute strongest in the entire body. Now, I'm trying to visualize the forces at play here. When we stand upright, our center of gravity actually falls slightly behind the axis of the hip joint. Technically, gravity should just fold our upper half backward over our legs. Does this Y ligament act like a heavy-duty tie-down strap to prevent that?
That is exactly its primary function. When you extend your hip to stand up straight, that massive iliofemoral ligament twists and tightens intensely. It literally wrings the capsule like a towel, physically locking the head of the femur deep into the acetabulum.
But we don't have to constantly flex our core or leg muscles just to remain upright.
Right. It allows humans to stand for long periods of time with minimal muscular energy. We are essentially just resting on the incredible tensile strength of this passive mechanical lock.
That's wild.
It's so strong it actually dictates how far back you can extend your leg. You can only bring your leg back about 10 to 20 degrees past a vertical position before the ligament stops you cold.
That is amazing engineering. And it's flanked by two other ligaments. You have the pubofemoral on the bottom front, which tightens up to prevent excessive abduction, so stopping your legs from doing an involuntary split, and then the ischiofemoral on the back.
Though it's worth noting, the one on the back is the weakest of the three capsular ligaments, simply because the front of the joint absorbs so much more tension during upright bipedal posture.
Now there's one more internal ligament that is just too bizarre not to mention. The ligament of the head of the femur. It sits deep inside the capsule, anchoring the very top of the femur ball directly to the bottom of the socket. But functionally, it contributes almost zero structural strength to the joint.
Yeah, it's mechanically useless for stability.
Then why run a weak internal bungee cord through a highly pressurized joint?
Because it's not a tether, it's a biological conduit. Inside that small ligament runs a tiny branch of the obturator artery.
Oh, I see.
Yeah, the ligament acts as a protective, synovial fluid-covered sleeve that delivers a dedicated blood supply directly into the core of the femoral head. It ensures the bone stays alive, safely routing a blood vessel right through the center of a high-friction moving joint.
It just proves the body wastes absolutely zero space. So the bones are formed, the ligaments are locked in, but bone and ligament are passive tissues. Now we have to talk about the active systems, the muscle engines that drive the movement, and the nerve wiring that monitors it all.
Because it's a ball and socket, the hip operates with 3 degrees of freedom. It flexes and extends, so bringing the knee up to the chest or kicking it back. It abducts and adducts, moving the leg away from the body or crossing the midline, and it rotates internally and externally.
The rotation aspect is what really caught my attention. I generally think of the hip's primary power as moving a straight line forward and backward for walking or running.
Sure, most people do.
But anatomically, external rotation, so pointing your toes outward, is vastly more powerful and freer than internal rotation. Why is the hardware so biased toward turning the leg outward?
It comes down to the sheer volume of muscle mass leveraging the joint, pitted against the tension of the ligaments we just discussed. For external rotation, you have the massive engine of the gluteus maximus, your primary extensor, but also a powerful rotator, pulling the femur back and out. But it doesn't work alone.
Right, there's a whole team of deep muscles behind it.
Exactly. You have a dedicated team of 6 smaller muscles buried deep in the hip, like the piriformis and the obturator internus. Think of them like small, highly specialized tugboats working alongside the massive cruise ship of your gluteus maximus.
I love that analogy.
They are all pulling in unison to turn that femur outward.
And on the flip side, internal rotation relies on a much smaller muscle team. Plus, the moment you try to turn the leg inward, you're fighting against the immense tension of those posterior ligaments.
The hardware simply favors external power and extension, which serves us perfectly for planting our feet, changing directions quickly, and propelling our body weight forward.
Now, with all these complex moving parts, the sensory network monitoring them has to be expensive. Let's talk about the nerve connection.
This raises an important question about how we actually experience pain in our lower body. The innervation of the hip joint is a massive intersection of signals. It receives nerve supply from multiple branches of the lumbosacral plexus, which is the nerve network emerging from your lower spine.
It is completely surrounded. The femoral nerve hits the front, the obturator handles the bottom, the superior gluteal takes the top.
It is entirely surrounded, but that dense overlapping wiring leads to a very common clinical trap. Because major nerves like the femoral and obturator supply the hip joint and then travel all the way down the leg to innervate the knee joint, well, the brain can easily misinterpret where a pain signal originates.
Oh, this is the phenomenon of referred pain.
Exactly. Primary hip pain is frequently referred to the knee. A patient might come into a clinic absolutely convinced they have a severe knee injury. Their knee aches constantly, but mechanically their knee is pristine.
That's incredible.
The actual pathology, maybe severe arthritis or a torn acetabular labrum, is happening deep inside the hip. The brain is just taking that distress signal and projecting it down the nerve pathway, making it feel like it's originating in the knee.
That is wild. So if you're listening to this right now and your knee is inexplicably aching but you haven't injured it, the culprit could literally be a distress signal radiating down from your acetabulum. It just highlights how perfectly integrated the entire lower limb system is.
It really is a diagnostic puzzle that perfectly illustrates the interconnectedness of human anatomy.
So what does this all mean? We started this deep dive looking at a very strange 3-piece bony puzzle in children. But when you track how it fuses, how it aligns, and how it moves, it's clear the hip is not just a biological hinge. It is a dynamic, living suspension system. It combines the deepest socket in the body with the strongest ligament we possess, all working together to conquer the massive crushing forces of gravity.
It is something we completely take for granted until it stops working smoothly. Honestly, the next time you simply stand up from a chair, try to visualize the invisible engineering happening in that split second.
Right.
That mundane movement requires the massive power of your gluteus maximus to lever your torso up, and the perfectly timed twisting of the iliofemoral ligament, tightening like a vice to lock you safely into an upright posture.
It really is a masterpiece of evolutionary engineering. But it leaves me with one final thought to ponder, looking beyond just the anatomy and into how we actually live today. The hip joint was designed through millions of years of evolution specifically for upright striding and bearing massive weight across long distances. It is engineered to move.
Yeah, we're built for walking.
Yet in our modern world, we spend up to a third of our lives sitting in chairs. It's a posture that keeps our powerful flexor muscles chronically contracted and leaves that crucial heavy-duty Y ligament completely slack. It makes you wonder, if human evolution continues to adapt to the environments we build for ourselves, what will the hip bone look like in 1,000 years if it becomes a joint designed primarily for sitting at a desk rather than striding across the savannah? Thank you so much for joining us on this deep dive. Keep moving, and we'll catch you next time.